In October 2009, the Charité Berlin turned into a meeting point for politicians, scientists, the medical community, economists, and the civil society. They participated in the first World Health Summit to achieve health as a basic human right for everyone. These huge challenges can only be met together.
We have concomitant epidemics of both HIV and tuberculosis, especially in Africa.
We need to change what we do, but also how we do it.
We know that climate change already presents real risks for human health.
We do have a lack of vision. Our lack of vision is a lack of clarity of the big picture.
Yes, I think that the system got stuck with a lot of regulations, particularly for clinical studies.
Having doctors who don't understand evolutionary biology is really limiting our ability to understand and treat disease.
We need to have a very focused sense of how we actually achieve access to the basic health care.
There is a huge potential to make a contribution to improve quality of care and to optimize cost.
There are lots of things, the big problems we're facing, where we must act together.
Charité Berlin, under the patronage of Chancellor Angela Merkel and President Nicolas Sarkozy, the traditional medical university offered an ideal platform for more than 700 participants from over 60 countries to work on solutions for these challenges. Medicine has reached a high level of development. But how can we bring the fruits of research to the people? What impact does climate change have on people's health? How can we adjust our health systems facing these challenges? What answers do politicians, scientists, economists, and the civil society have to infectious disease and pandemics? The World Health Summit 2009 started to join the power of important decision makers from different disciplines into one voice, concrete advice, and call for action to improve the health of the people. With the World Health Summit, academic medicine raises its voice in global health discussions. The medical community will take more responsibility in this global health discussion. The foundation of the M8 Alliance, a global network of prestigious universities, institutions and health centres, forms the academic basis for realising the goals of the summit.
MA contains a huge amount of very important and very distinct persons in all disciplines, in science and in policy making. And I think this power should be utilized to advise politicians, to advise universities, and to advise scientific institutions all over the world.
The World Health Summit was an important first step on the way to an improved global health.
We had, I think, 8 ministers of health in the session I was in yesterday. So, you know, they were there, they were hearing what was said, and they were contributing.
This meeting is a terrific meeting because it brought together people from multiple disciplines and multiple points of view.
So this is encouraging, but again, just a beginning. We have to make more and more meetings like this to convince general world population that this is the only solution.
The human right to health is realisable. We can get essential medicines to people in difficult parts of the world. We can get vaccines to children. We can build health systems. So we should be immensely optimistic about what we can achieve for the poorest people. And we've seen examples of that at this meeting this week.
Berlin 2009 marked claims and created future aspirations. Summit President Detlev Ganten presents the perspective for the next summit in October 2010.
The 2009 summit was so successful that we need to continue. Of course, there are new problems. Medical knowledge is increasing every day. People around the world are expecting that this knowledge is translated into medical progress and better health around the world to the people. The world is changing, climate is changing, people are getting older, the world is in transition, and we have to cope with this transition. And also we have to develop a new health policy. We have to transform our health systems from a sick care system to a healthcare system, a true healthcare system.
Berlin 2009 was a first step towards an improved global health, an ambitious aim that can only be achieved when all global players join forces for a combined strategy.